And even though I have insurance, what I pay for, which is in excess of $200 a month now in premiums, still does not cover many of my basic health care needs. So the situation that I've been facing frequently over the last couple of years is paying an extremely high premium every month, then going to get the services that I need, trying to tap into my insurance to pay for those services, but they don't cover them, and they don't cover them enough, and I'm still left with exorbitant amounts of debt to the places where I get my medical care from. That indicates to me that something is very broken about our healthcare system, and I'm someone who actually can afford, at least right now, but barely, to pay these premiums.
It's just for catastrophic care, so I'm not going for checkups, I'm not going for mammograms. And you're at this point where, like, is health insurance, we need it because I don't want to go bankrupt because of if I had to go into the hospital for some reason. But on the other hand, I'm paying a lot of money out and I'm fearful.
You know, we don't do the wellness checks as much. Like we did with carpenters, you know, even the dental cleaning, like that was covered. So we went every year, all of us went twice a year. And then for the wellness checkups, I went every year with the kids and myself, pap smearing, and so yeah, we don't do that as much unless there's like a physical they need for school, or you know, if there's something they need through sports.
It's a $500 deductible policy, so it for practical purposes doesn't cover any primary care, and it on its face doesn't cover any well person care anyhow. There's no preventive coverage in there at all. So essentially what we're covered against is if he has a very difficult accident with high bills. And of course we're grateful for that, and that's why we buy the insurance. But he, for practical purposes, has no health coverage and no access to health care of a preventive or primary nature to treat conditions early or to prevent things from happening to him.
It feels to me with insurance that nothing is covered. I know that if I have a catastrophic illness or accident that will be covered. But when you go into the hospital or into your doctor's offices, you have to, even before you agree to have something done, you have to find out if it's covered or not.
Another very important thing is to pay for screenings, because the screenings are preventive and it's the right thing to do. And when you do the right thing, it always costs less in the long run. If you prevent a calamity, then you don't have to pay for it later on.